So, a little history. I'm going to start you off, kind of start you out light, and then I'm going to let the heavy hitter pop in. Good old Lucas. I told him, I said, so I want a special guest. Do you think we can call you as my special guest all the way from, Ada, Michigan? so Lucas is going to come in and give you a little bit more of what he does in the room. So you get to see like what kind of goes through. If you've never been in acoustic compression, you've never actually had any of that, Lucas is going to give you a little talk through of what he talks about. We're going to give you some research behind what's happening. So a little history behind acoustic compression. Originally called extracorporeal shockwave therapy, so those terms are used. A little back and forth. Acoustic compression, basically sound waves. That's what shockwave is. So back in World War II, when they detonated hydrogen bombs, the submarine crews actually had induced injuries to their lungs. And they could only figure out that that was actually due to the shock waves coming from the hydrogen bombs. Nothing else was damaged, just their lungs. So they couldn't understand as to why. So then they started to look a little bit deeper into this, and they found that the electrohydraulic generated shock waves were able to crush ceramic plates in water. Pretty cool, maybe. So about in the 50s is when most of your medical world started to actually look at, hey, we might be able to use this in treatment. The very first thing that we actually used in treatment was for kidney stones. That's how most people know of extracorporeal shockwave therapy, is going through kidney stones. They call it lithotripsy. So breaking up of the kidney stone to help it come through the ureter so that somebody can pass them. So in 1988, in Germany, they did the first union of a non-bone, so a fracture or a break is what they ended up using, okay? You can use this quite a bit for fractures and breaks. It does help to heal them in a faster amount of time. Acoustic compression is not painless. Don't let anybody tell you it's painless, because there is some pain that is transferred from that. Whenever you send a sound wave into a damaged cell, what you're doing is producing waves through that cell. You're producing more capillary refills, so that you're permeating those capillaries. Those capillaries are filling with oxygen, dumping their extracellular fluid, whatever it may be, whether that's breaking up of scar tissue. So that change does create pain. So obviously we just talked about the change of the cellular membrane. There's release of neurotransmitters when this happens. What are neurotransmitters? Anybody know? Things that happen in the brain. So neurotransmitters, a lot of people think of like endorphin release or relaxation. That's some things that actually chiropractic adjustments do, releases an endorphin release. So it relaxes the body, it helps the body to feel good. So you're getting some of the release of the neurotransmitters. So when you see, as people go in and they'll go, oh, it's really painful as you do it, over time, as the treatment's going on, it gets less painful. And it's due to the fact that you're getting more endorphin release and the body is relaxing and going through some healing. You also get some antibacterial effects out of this. Anytime you change the cellular permeability in the positive way, you're actually building the body's immune system back up, so it's going to fight off any bacteria that might be in there. There's also some antivirals as you go through this. Release of nitric oxide, the stem cell migration and differentiation, so this is building new cells up. So say I have a chronic ankle issue that's been going on for years and years and years. Doesn't mean that it couldn't change it. It does actually help to repair that old tissue that's been scarred, so it helps to rebuild it over time. And you'll get new vessel growth as well. So people that have like bad veins, you can actually see vein repair. We've actually seen within some of our x-rays, like spinal stenosis, decrease. Like you can actually see the foraminal hole opening on a nerve where the nerves come through. So I pulled out some research. Where's my look? Can you hand me that little paper, please? So I pulled out some of this research, and then I pulled out a couple extra because I thought, well, there's some really cool stuff that goes out there. So I chose to compare the acoustic versus laser and acoustic versus ultrasound, because those tend to be the most common ones that are used for, tendinitis, bursitis, low back pain. You're looking at, they will even use it now for tissue lesions. So myofascial pain syndrome, basically trigger point pain. So a lot of people will call this like fibromyalgia style pain, as a lot of the myofascial pain syndrome. So what they did is they used laser versus extracorporeal shockwave. So as you see here, it's not necessarily as even, because they did 10 laser sessions versus 3 sessions of the acoustic. And they also added stretching with each of them, okay? So basically you did 3 times a week with your laser, you did once a week with your extracorporeal shockwave or your acoustic. 1 month after treatment, both were effective, but the laser had less pain at the 2-week mark. Well, of course, you've had 6 treatments compared to 2. Pretty simple. I use the laser in my horse work. Yeah, it does. Anytime you heat something up, you warm it up, it feels better over time. And yes, laser needs to be used more to get the results that you can get out of the acoustic, but you have to use it more often. Plantar heel pain. So, pain down here. Laser had 10 sessions. The extracorporeal shockwave or acoustic had 3 sessions. They did walking testing and a visual analog scale, which basically a visual analog scale is they'll put up different pain scores, like, okay, I feel really bad, I feel okay, not so great, awesome. Laser was more effective here, but that's, once again, you're doing 10 sessions versus 3 over time. If you go 2 to 3 months later, you actually see that the pain continues to decrease with both of these, so then they become equal at 2 months, 3 months out. So not always equal things as you look through. So a plantar fasciitis one. Plantar fasciitis is pretty tough because this one actually compared it to basically the endoscopic plantar fasciotomy. Does anybody know what that is? Probably not. Not as common. I don't see this happen very much. It's basically where they'll go in and cut the fascia on the bottom of the foot. So plantar fasciitis, basically the fascia in the foot is, you have the skin, fascia layer, and the muscle. Okay, and that fascia layer, they go in and cut the big one, the big piece that basically covers the entire bottom of the foot. So what they had found is that you get similar outcomes with each, but unfortunately with the fasciotomy, you didn't get to exercise throughout. With the extracorporeal shockwave, acoustic compression, you were able to exercise the entire time, still had the same outcomes. One, you got to get by with obviously less money because you didn't have to do this major, well, it's not major surgery, but a surgery in general, and then PT afterwards, whereas you just had to do the stretching and continue your exercise with acoustic compression. Now, I did find a couple others that were on lateral epicondylitis. So basically, they did treatment with laser versus extracorporeal shockwave. They decided that they would reevaluate at the 4th and 12th weeks. Everything, they seem to be significantly better with extracorporeal shockwave at both the 4th and the 12 weeks. And what they found is both are effective and safe treatments for lateral epicondylitis, but they feel like the extracorporeal shockwave or acoustic is more efficient at pain reduction and improvement of functions. And really ultimately, as all of these have shown, versus laser versus acoustic, you get by with 1/3 of the treatments in the long run. To me, that's a big deal because when you don't have to walk into an office 3 times a week versus 1 time a week, that helps, 1, the pocketbook, 2, your time schedule. It's much easier to make it through if you're having to do half the treatments. Now, the only one that I found there really wasn't a lot versus ultrasound. And I don't know if it's just too new or they're just not doing as many ultrasound testing, but basically what they did is they did it on tennis elbow. And after 3 months with the extracorporeal shockwave, the post-treatment had a greater decrease in pain than the ultrasound. Once again, this was a 1/3 amount of the acoustic compression treatments versus 3 times the amount of ultrasound. The ultrasound treatments were 3 times a week versus 5 treatments, which is 1 per week. So they basically did 5 weeks of extracorporeal shockwave versus 3.5 to 4 weeks of ultrasound. So once again, I mean, you'll get the same with when you're looking at, and this is always hard for most people to understand, when you're dealing with different therapies out there, it comes down to time, money, cost, what do you have to do? And when you do acoustic compression, because it changes so much of the cellular function, it can go so much deeper than ultrasound, it can go deeper than your lasers. You get more of a cellular change long term, and it continues to go on and on for months to a year later after your first treatment. So when you get stem cell regeneration, which has been proven with extracorporeal shockwave or acoustic compression, but not necessarily with laser or ultrasound. That is not something that has been proven across the board. So to us, that's really great because say I'm using it on a heel spur over time. The heel spur, the body doesn't want the heel spur naturally, it's not there. So it will absorb it over time if you figure out a way to take that imbalanced pressure away. So whether or not that was because the calves were too tight, because the plantar fasciitis was bothering them, imbalance if we're walking pronated or supinated, if we're putting them in orthotics, all of those things make a difference. And then you can work for the body to allow it to reabsorb some of those bones that's not supposed to be there. So it's really, really a cool thing when you come down to treatments. Acoustic compression has outdone most of the other things when it comes down to low back pain, when it comes down to chronic bursitis, when it comes down to tendonitis. These things, it gets it done in a much faster time. And ultimately can restore function for people that haven't had function in a long time. So there's just some of your research that's out there versus one versus the other. I'm going to turn you loose with Lucas and let him kind of give you the idea of what he actually sees in the room more consistently, because him and Blake are in there all the time and get to see all the changes that we get to talk about, but they're there. So I'm going to turn it over to you.